Hello there, everyone, and welcome. It's so good to have you with me today. Let me ask you something that I know many of us have experienced, especially as we get a little older. Have you ever been sound asleep, maybe dreaming peacefully, only to be jolted awake by that sudden, intense, vice-like grip in your calf or your foot? That agonizing leg cramp that just seems to come out of nowhere in the middle of the night, making you want to cry out. Oh, I know that feeling. You try to stretch it out. Maybe you jump out of bed and hobble around, desperately trying to get some relief. And all you can think is, not again. Why does this keep happening? Those nighttime leg cramps, they're more than just an annoyance, aren't they? They rob us of precious sleep, leave our muscles sore and tender the next day, and can even make us a little bit anxious about going to bed, wondering if tonight will be another cramp night. It's a really common complaint, especially for folks over 60, but just because it's common doesn't mean we have to just put up with it and accept it as an inevitable part of aging. Because the truth is, we don't. Many people think leg cramps, particularly those pesky nighttime ones, are just due to getting older or maybe not moving around enough. And sometimes those can be factors, but often there are other surprising culprits behind these painful interruptions to our sleep, things we might not even realize are contributing. And the wonderful news is that by understanding these underlying causes, we can often find some very effective, doctor-approved ways to send those cramps packing for good. So, in today's video, we're going to dive deep into this very topic. We're going to explore Stop Nightly Leg Cramps for Good, 5 surprising causes and doctor-approved fixes. We'll uncover some of those less obvious reasons why your legs might be rebelling in the middle of the night. And then we'll talk about practical, sensible things you can do, things that are often recommended by medical professionals to help prevent them and get back to enjoying restful, uninterrupted sleep. This isn't about quick fixes that don't last. It's about understanding your body better and making sustainable changes for long-term relief. Sound good? All right, let's start by exploring the first surprising cause. And it's something so fundamental to our overall health, yet often overlooked when it comes to muscle cramps: dehydration. Yes, simply not drinking enough water throughout the day can be a major trigger for those painful nighttime leg cramps. It might sound almost too simple, but water plays an absolutely crucial role in how our muscles function. Our muscles are about 75% water, and they need proper hydration to contract and relax smoothly. When we're dehydrated, even mildly, the balance of electrolytes in our body, things like sodium, potassium, and magnesium, which are vital for nerve signals and muscle contractions, can get thrown off. This imbalance can make our muscles more irritable and prone to cramping, especially when they're relaxed during sleep. Think about it. As we get older, our sense of thirst can sometimes diminish a little. We might not feel thirsty as readily as we did when we were younger, even when our body actually needs fluids. Plus, some medications that many seniors take, like diuretics for high blood pressure, can increase fluid loss. And if you live in a warm climate, or you've been more active during the day, you're losing even more fluids through sweat. If you're not consciously making an effort to replenish those fluids throughout the entire day, by the time night rolls around, your muscles might be parched and primed for a cramp. It's not just about chugging a big glass of water right before bed. In fact, that might just lead to more bathroom trips. It's about consistent hydration from morning till evening. So, what can we do? A great first step is to be more mindful of your fluid intake. Try keeping a water bottle handy throughout the day and sipping from it regularly, even if you don't feel particularly thirsty. Aim for plain water as your primary source of hydration. Herbal teas, or even fruits and vegetables with high water content like cucumbers, celery, watermelon, and oranges can also contribute to your overall fluid intake. How much is enough? The old 8 glasses a day is a general guideline, but individual needs can vary based on your activity level, the climate, and any health conditions or medications. A good indicator is the color of your urine. It should ideally be a pale yellow. If it's consistently dark yellow, that's often a sign you need to drink more. If you're unsure about how much water is right for you, especially if you have conditions like heart failure or kidney disease, where fluid intake needs to be carefully managed, it's always best to have a chat with your doctor. But for many of us, simply making a conscious effort to drink more water regularly can be a surprisingly effective first line of defense against those unwelcome nighttime leg cramps. It's a simple change, but it can make a world of difference to your muscle health. Now, moving on from how much water we drink, let's consider what might be missing from our diet that could be setting the stage for those cramps. This brings us to our second surprising cause: imbalances or deficiencies in key minerals, particularly magnesium, potassium, and calcium. These minerals are electrolytes, and as we touched on with dehydration, they are absolutely essential for proper nerve and muscle function, including the smooth contraction and relaxation of our muscles. When levels of these minerals are too low, or if the balance between them is off, it can lead to increased muscle excitability and a higher likelihood of cramping. Let's talk about magnesium first. Magnesium is a real workhorse mineral involved in hundreds of biochemical reactions in the body, including muscle relaxation. If you're low in magnesium, your muscles might have a harder time relaxing after contracting, leading to spasms and cramps. Unfortunately, magnesium deficiency is quite common, partly because modern farming practices can deplete magnesium from the soil, and also because some medications can interfere with its absorption or increase its excretion. Stress can also deplete magnesium levels. Then there's potassium. Potassium works closely with sodium to regulate fluid balance and is crucial for transmitting nerve signals that tell muscles when to contract and relax. Low potassium levels, a condition called hypokalemia, can lead to muscle weakness, fatigue, and, you guessed it, cramps. This can sometimes happen if you're taking certain diuretics or if you've had a bout of vomiting or diarrhea. Calcium is another key player. While we often associate calcium with bone health, it's also vital for muscle contraction. If calcium levels are too low, or if the body isn't regulating calcium properly, it can affect how muscles contract and lead to cramping. So, if you're frequently experiencing leg cramps, especially at night, it's worth considering if your diet is providing enough of these crucial minerals. The good news is that many delicious, healthy foods are packed with them. For magnesium, think leafy green vegetables like spinach and Swiss chard, nuts and seeds, especially almonds, cashews, and pumpkin seeds, legumes like beans and lentils, whole grains, and even dark chocolate, in moderation, of course. For potassium, bananas are famously a good source, but don't stop there. Other excellent sources include potatoes, especially with the skin on, sweet potatoes, avocados, beans, spinach, yogurt, and fish like salmon. And for calcium, while dairy products like milk, cheese, and yogurt are well-known sources, you can also find calcium in fortified plant milks, canned fish with edible bones like sardines and salmon, leafy greens like kale and collard greens, and tofu made with calcium sulfate. Focusing on a balanced diet, rich in a variety of whole foods, is the best way to ensure you're getting an adequate supply of these cramp-fighting minerals. It's about creating a nutrient-rich internal environment where your muscles have everything they need to function smoothly. However, it's also important to note that if you suspect a significant deficiency or if you're considering taking mineral supplements, it's really best to talk to your doctor first. They can assess your individual needs, perhaps even do a blood test, and advise you on a safe and effective approach. Self-supplementing with high doses of certain minerals can sometimes cause other problems or interact with medications. But starting by consciously including more mineral-rich foods in your daily meals, that's a fantastic, safe, and doctor-approved step you can take right away. Alright, so we've talked about how crucial proper hydration is and how imbalances in key minerals like magnesium, potassium, and calcium can contribute to those dreaded nighttime leg cramps. Just by being more mindful of drinking enough water and including plenty of mineral-rich whole foods in our diet, many people can see a real improvement. These are excellent foundational steps. Now let's delve into a third surprising area that might be linked to your leg cramps, and it's something many of us rely on daily without necessarily thinking about its potential side effects. I'm talking about certain medications. It's a fact of life that as we get older, many of us may be taking one or more medications to manage various health conditions. These medications are often vital for our well-being, helping to control blood pressure, manage cholesterol, deal with diabetes, or address other issues. And while they can be incredibly beneficial, it's also true that almost all medications come with a list of potential side effects, and for some common drugs, leg cramps can unfortunately be one of them. This doesn't mean you should stop taking your prescribed medication, absolutely not. But it does mean it's worth being aware of this possibility and discussing it with your doctor if you're experiencing persistent cramps. So, which types of medications are sometimes associated with an increased risk of leg cramps? Diuretics, often called water pills, are a common example. They are frequently prescribed for high blood pressure or heart failure, and they work by helping your body get rid of excess salt and water. While this is beneficial for blood pressure, it can also lead to the loss of important electrolytes like potassium and magnesium, which, as we just discussed, can trigger muscle cramps if levels get too low. Another group of medications that sometimes get flagged are statins. Statins are widely used to lower cholesterol and are very effective in reducing the risk of heart attacks and strokes. However, a known, though not extremely common, side effect for some individuals taking statins is muscle pain or cramping. The exact reason isn't always clear, but it's something to be aware of if you're on a statin and experiencing new or worsening leg cramps. Some medications used to treat asthma or COPD, like certain bronchodilators, can also occasionally cause muscle cramps as a side effect. Even some drugs used for Alzheimer's disease or osteoporosis have been linked to muscle cramping in some patients. It really varies from person to person and from drug to drug. The important thing here is not to self-diagnose or make any changes to your medication regimen on your own. If you've started a new medication and soon after notice an increase in leg cramps, or if you've been on a medication for a while and the cramps are becoming more problematic, the best course of action is to have a conversation with your doctor or pharmacist. They are the experts. They can review all your medications, including any over-the-counter drugs or supplements you might be taking, to see if there could be a connection. Sometimes, the solution might be as simple as adjusting the dosage or switching to a different medication within the same class that might have fewer side effects for you. Or If a medication is known to deplete certain minerals, your doctor might recommend specific dietary changes or even a supplement like potassium or magnesium, but only under their guidance to counteract that effect. The key is open communication with your healthcare provider. Don't just assume the cramps are something you have to live with. If you're on medication, there might be ways to manage both your underlying health condition and reduce the cramping. Keeping a little diary of when the cramps occur and how severe they are, especially in relation to when you take your medications, can sometimes provide helpful clues for your doctor too. Now let's shift gears a bit from what we put into our bodies to how we use our bodies. Our fourth surprising cause of nighttime leg cramps can be related to either too much, or perhaps more commonly, too little physical activity, or even just the type of activity we're doing. It might seem a bit contradictory, but both overexertion and a lack of regular movement can set the stage for muscle cramps. Let's talk about overexertion first. If you suddenly engage in a strenuous activity that your muscles aren't used to, maybe you spend a whole day gardening after a long winter, or you go on an unusually long walk or hike, your muscles can become fatigued and more prone to cramping later on, often when you're resting at night. This is because intense exercise can lead to minor muscle damage and an accumulation of metabolic byproducts, which can irritate nerve endings and trigger cramps. It can also lead to greater fluid and electrolyte loss through sweat, tying back to our earlier points. On the flip side, and this is often more relevant for many seniors, a lack of regular physical activity or a very sedentary lifestyle can also contribute significantly to leg cramps. When our muscles aren't used regularly, they can become weaker, tighter, and less flexible. Blood flow to the muscles might also be reduced if we're not moving around much. Think of it like a car that sits in the garage for too long. Things can get a bit stiff and sluggish. Muscles that are deconditioned and tight are much more likely to spasm or cramp, especially when they're suddenly asked to do something, or even just when they're trying to relax at night. Even the way we sit or stand for long periods can play a role. If you spend a lot of time sitting with your legs in a particular position, or if you stand for hours on a hard surface, certain muscles can become chronically tight or fatigued, making them more susceptible to cramping later on. So, what's the sweet spot here? It's about finding a balance with regular, moderate physical activity that keeps your muscles strong, flexible, and well-conditioned without overdoing it. Gentle, consistent movement is key. Regular walking is fantastic. Stretching exercises, especially for the calf and hamstring muscles, can be incredibly helpful in preventing cramps. Simple range of motion exercises for your ankles and feet can also improve circulation and flexibility in those areas. If you're starting a new activity, it's always wise to increase the intensity and duration gradually to allow your muscles to adapt. And if you've had a particularly active day, doing some gentle stretches before bed might help to relax those hard-working muscles and ward off nighttime cramps. Conversely, if your days tend to be quite sedentary, making a conscious effort to incorporate more movement, even short walks, standing up and stretching every hour, or doing some simple chair exercises, can make a big difference in keeping your muscles happier and less prone to cramping. It's about keeping things in balance and listening to what your body is telling you. We don't want our muscles to be overworked and exhausted, nor do we want them to be underused and stiff. Finding that happy medium of regular, gentle activity is a powerful strategy against leg cramps. So, we've explored how dehydration, mineral imbalances, certain medications, and even the amount or type of physical activity we engage in can all play surprising roles in triggering those painful nighttime leg cramps These are all important areas to consider. Now let's move on to our fifth and final surprising cause, and this one relates to the intricate communication system within our bodies, underlying nerve or muscle issues, or even how our nerves are being affected by other structures. Sometimes, leg cramps aren't just a simple case of a tired or dehydrated muscle. They can be a symptom of something a bit more complex happening with the nerves that control those muscles, or with the muscles themselves. For instance, conditions like peripheral neuropathy, which is damage to the nerves outside of the brain and spinal cord, often in the legs and feet, can lead to symptoms like pain, tingling, numbness, and yes, muscle cramps. Diabetes is a common cause of peripheral neuropathy, but it can also result from other conditions, vitamin deficiencies, or even certain injuries. When these nerves aren't functioning properly, they can send faulty signals to the muscles, causing them to contract involuntarily and painfully. Another possibility, especially as we age, relates to changes in our spine. Conditions like lumbar stenosis, which is a narrowing of the spinal canal in the lower back, can put pressure on the nerves that travel down to our legs. This pressure can irritate the nerves and trigger pain, weakness, or cramping in the legs, often worse when standing or walking for a while, and sometimes relieved by bending forward or sitting down. This is sometimes called neurogenic claudication, and it can feel similar to the claudication we discussed in a previous video related to circulation, but the underlying cause is nerve compression rather than poor blood flow. Even something like a pinched nerve elsewhere, perhaps from a bulging disc or arthritis in the spine, could potentially refer pain or trigger cramping down into the leg. And sometimes, though less common, underlying muscle diseases themselves, known as myopathies, can present with cramping as a symptom. The reason I bring these up is not to cause alarm, but to highlight that if your leg cramps are severe, very frequent, don't seem to respond to the simpler home care measures we're about to discuss, or if they're accompanied by other concerning symptoms like persistent weakness, loss of sensation, changes in bowel or bladder function, or pain that radiates in a specific pattern, it's really important to see your doctor. They can do a proper evaluation to rule out or identify any underlying nerve or structural issues that might need specific medical attention. Trying to self-diagnose these more complex situations isn't advisable, but being aware that these possibilities exist helps us know when to seek professional medical advice beyond simple home remedies. Okay, so we've talked about 5 surprising and sometimes interconnected causes of those disruptive nighttime leg cramps: dehydration, mineral imbalances, medication side effects, issues with physical activity levels, and potential underlying nerve or muscle conditions. Understanding these potential triggers is the first powerful step. Now let's shift our focus to the really good news. What can we actually do about it? Let's talk about some doctor-approved fixes and lifestyle changes that can help you stop those nightly leg cramps for good and reclaim your peaceful sleep. The first, and often most impactful group of fixes, revolves around those foundational elements we discussed earlier. Making sure you are adequately hydrated throughout the day is paramount. Keep that water bottle handy. And focusing on a balanced, nutrient-rich diet packed with foods high in magnesium, potassium, and calcium can make a huge difference. Think leafy greens, nuts, seeds, beans, fruits like bananas and avocados, and dairy or fortified alternatives. These are cornerstones of good muscle health. Next, let's talk about gentle stretching, especially before bedtime. This is a classic, doctor-recommended strategy for preventing leg cramps. Tight muscles are cramp-prone muscles. Taking just a few minutes before you hop into bed to gently stretch your calf muscles, hamstrings, the muscles at the back of your thighs, and even your feet can help to relax them and make them less likely to spasm during the night. How do you do a simple calf stretch? Stand facing a wall, about arm's length away. Place your hands on the wall for support. Step 1 foot back, keeping that leg straight and your heel flat on the floor. Gently lean into the wall until you feel a stretch in the calf of your back leg. Hold for about 20 to 30 seconds. Then switch legs. Repeat a couple of times. For your hamstrings, sitting on the floor with one leg straight out and the other bent. Gently lean forward from your hips towards your outstretched foot until you feel a stretch in the back of your thigh. Hold, then switch. Always stretch gently, never to the point of pain. Another doctor-approved tip is to consider your sleeping position and bedding. Sometimes, heavy blankets or tightly tucked-in sheets can force your feet into a downward-pointing position, plantar flexion, for long periods, which can shorten the calf muscles and make them more prone to cramping. Try loosening the covers at the foot of your bed, or if you sleep on your back, perhaps prop your feet up slightly on a small pillow to keep them in a more neutral position. Some people find that sleeping on their side with their knees slightly bent can also be more comfortable and less likely to trigger cramps. What about when a cramp does strike in the middle of the night? The immediate goal is to try and stretch the affected muscle. If it's a calf cramp, you can try gently pulling your toes up towards your shin, or carefully standing up and putting a little weight on the cramping leg. Massaging the cramped muscle can also help to relax it and ease the pain. Sometimes, applying a little warmth, like a heating pad, on a low setting or a warm compress, to the muscle after the initial intense spasm has passed can also be soothing and help it relax further. Conversely, some people find that a cold pack helps to numb the pain. If you suspect your medications might be contributing, as we discussed, don't stop them, but do schedule that chat with your doctor. They are your best resource for figuring out if an adjustment is possible or needed. And regarding physical activity, remember that balance. Engage in regular, gentle exercise like walking or swimming to keep your muscles strong and flexible, but avoid sudden, intense overexertion. And if you do have a more active day, remember those pre-bedtime stretches. Even simple things like riding a stationary bicycle for a few minutes before bed can sometimes help improve circulation to the legs and reduce cramping. It's also worth taking a look at your footwear. While less directly linked to nighttime cramps, wearing supportive shoes during the day can prevent excessive muscle fatigue that might contribute to cramping later on. Now, all these tips, hydration, diet, stretching, sleep position, medication review, balanced activity, are generally safe and often very effective. They are the kinds of things your doctor would likely encourage you to try. The key is consistency. You might not see results overnight, but by incorporating these habits into your daily and nightly routine, you are actively working to create an environment where leg cramps are far less likely to occur. It's about taking a holistic approach. Think of it as nurturing your muscles from the inside out with good nutrition and hydration, and from the outside in with gentle movement and stretching. It's about being an active participant in your own well-being. Remember, those painful nighttime leg cramps don't have to be a nightly battle you just endure. By understanding some of the surprising reasons they happen, and by consistently applying these doctor-approved fixes, you really can hope to stop them for good, or at least significantly reduce their frequency and intensity. Imagine waking up feeling rested, without that lingering muscle soreness, ready to enjoy your day. That's absolutely a goal worth striving for. I sincerely hope that exploring these causes and fixes has given you some new insights, and more importantly, some actionable strategies you can start using right away. Don't feel you have to do everything all at once. Maybe pick one or two things that resonate most with you. Perhaps focusing on your water intake this week, or committing to 5 minutes of gentle leg stretches before bed. Small, consistent changes are often the most powerful. Now, I would be thrilled to hear from your experiences. Have you found anything particularly helpful in dealing with nighttime leg cramps? Are there any other surprising causes you've discovered or remedies that have worked wonders for you? Please do share your thoughts, your tips, and any questions you might have in the comments section below. Our community here is a wonderful place to learn from each other and offer support. And if you found this video helpful and you think it might benefit others who are also struggling with this common issue, please take a moment to give it a thumbs up by clicking that like button. It really does help the video get seen by more people. And of course, if you enjoy content like this, focused on practical ways to stay healthy, comfortable, and vibrant as we age, and you haven't already, please do click that subscribe button and the little notification bell. We'd love to have you as part of our growing community. Thank you so very much for spending this time with me today. Remember, you don't have to just live with nighttime leg cramps. There are steps you can take. Here's to peaceful nights, restful sleep, and waking up feeling good. Take wonderful care of yourselves, and I can't wait to see you in our next video.